I had went to the hospital. I had took a pregnancy test, and the doctor said, "You're pregnant." I couldn't believe it because it took me forever to conceive a baby. I was so excited. I'm finally gonna be a mom now.
I'm gonna be honest, I wasn't expecting it, but I was kind of excited as well as concerned because with my son, I had him preterm, so I didn't know what to expect.
It was going good in the beginning, and then one day I had my 20-week checkup. They told me that my cervix had opened and I was gonna have her early. I was terrified because having a baby early, you don't know if they're gonna survive or what's gonna be the outcome, or if they just be like a normal child.
While I was getting care, or so-called getting care, no one really explained anything to me. They would just make sure I got my vitamins. My water broke as I was going to the bathrooms, so I'm there. I don't know what to do. They kind of don't know what to do. No one really was explaining anything to me other than the fact that I needed to hold it and wait until a doctor arrived. My son, Josiah, was born at 33 weeks. After I had him, they realized that he had kind of a bubble over his stomach. They examined him further and realized that he had a bowel obstruction, so he would need immediate surgery, which they warned me that he probably wouldn't make it through, or if he did make it through, he probably wouldn't make it after.
I'm Dr. Judy Ruffin. I'm an obstetrician and gynecologist here at Southern Jersey Family Medical Center. And I chose to be an OBGYN because I've been dedicated to the well-being and health of women, all my life.
Hello?
A preterm baby is delivery of a baby before 37 weeks. Babies that are born preterm often have problems with their respiratory function, their breathing, their vision, learning disabilities, and sometimes bowel issues, maturation of their gut. Unfortunately, there can be increased risk for women of color to have preterm delivery and problems associated with preterm delivery. We try to mitigate that or decrease that risk by having regular interaction with your healthcare provider.
Our women's health coordinators are able to provide care to the patient and basically meeting them where they are. We see women prior to pregnancy. We see them throughout their entire pregnancy, and we really focus on the health and wellness of our moms after they deliver as well. She's one of our preterm labor moms. We have a great team of women that have just that. They have compassion, they have empathy. Most of them are mothers themselves, so they're able to relate and identify with the women that they see every day.
Okay, well, welcome.
Dr. Ruffin specifically, I stayed in touch with her, she stayed in touch with me. I hadn't experienced that before where a doctor actually cared to listen without just shunning me off and saying, "Oh, don't worry about it, you're fine." So she didn't do that. She heard me out and provided good feedback on what I should expect, what risks I could expect, or even what measures I could take myself to prevent anything from happening.
My relationship with my doctor is very good. If I ever have any questions or if I don't understand anything, she's always there to help me.
The first line is always recognizing your risk for preterm delivery and early intervention. One treatment option that we talk about is regular surveillance, and then there is a medication that we use frequently called 17-hydroxyprogesterone. It's an injection that we give on a weekly basis that has been shown in some instances to help reduce the risk of preterm delivery.
What could you tell me about it? I definitely brought it up to Dr. Ruffin about my concerns for preterm delivery because what I experienced with my son, I did not want to have to go through that again. She gave me as much information as I could take, specifically about 17P.
17P is available through the pharmacy. It can be delivered to the office or it can be delivered to the patient's home. The patient can come into the office every week and visit with the doctor or the nurse and get the injection.
I would recommend 17P because it increases your chance of having a full-term baby.
The education that we provide, the self-management tools that we give allows patients to be able to advocate for themselves, be able to make informed decisions, and overall just feel empowered and take charge of their own lives.
So having a boy and a girl, I was worried. I didn't know how that would work out. But they're both good, well-behaved. They love to play together. They're great.
She's funny. She's very loving. She's just a bundle of joy. I would like to see Dream just enjoy life and make something of herself.
I think ultimately we provide them hope.